I'm going to be discussing cerebral aneurysms and how dysbiosis of the gut microbiome may be a cause of ruptured aneurysms. An aneurysm is a bulging, weakened area in the wall of a blood vessel resulting in an abnormal widening greater than 50% of the vessel's normal diameter. An aneurysm may occur in any blood vessel but is most often seen in an artery rather than a vein. Cerebral aneurysms represent localized dilations of intracranial arteries caused by the weakening of the vascular endothelium in the brain. Most brain aneurysms are common but aren't serious, especially if they're small. Symptoms of an aneurysm may vary depending on the size and location, as well as whether it has ruptured. These can include severe headaches, which is often described as the worst headache of my life, nausea and vomiting, confusion, double vision or blurred vision, stiff neck, seizures, or sensitivity to light. Aneurysms are more common in adults, with most cases diagnosed in people over 40. Women are also more likely to have brain aneurysms than men, and a positive family history for intracranial aneurysms increases the risk. Other risk factors may include high blood pressure, smoking, excessive alcohol consumption, use of illicit drugs, head injury, or infection. The relationship between an aneurysm rupture and the gut microbiome is so far unclear. Therefore, a case control study was conducted over 1 year from 2019 to 2020, comparing the gut microbiome in patients with unruptured aneurysms and ruptured aneurysms to identify specific bacteria causing the rupture. To compare the gut microbiome of healthy people living in the same country, each case with the UIA was matched to one control who had neither undergone a surgical procedure nor taken any medicine. The participants were recruited from Osaka University in Japan. Fecal samples of patients with stable, unruptured cranial aneurysms and ruptured cranial aneurysms immediately after onset were collected. Their gut microbiomes were analyzed using 16S rRNA sequencing. A phylogenetic tree was constructed and a polymerase chain reaction was performed to identify the specific species. The gut microbiome profile of patients with stable UIAs and RAs were significantly different. At the phylum level, the relative abundance of Campylobacter in the RA group was significantly larger than that in the UIA group. These findings suggest that the gut microbiome is likely involved in the rupture of cranial aneurysm in the genus Campylobacter and Campylobacter ureolyticus. The genus Campylobacter causes campylobacteriosis, which is one of the most common causes of diarrhea. It is a bacterial infection you can get from undercooked poultry, raw milk, and untreated water. It's also possible to get sick from contact with infected animals. Most people recover without treatment in about a week. Specifically found in the study, Campylobacter ureolyticus are gram-negative bacteria that are helical or curved in shape, which can degenerate into a coccoid form. Ideally, we should compare the intestinal microbiota before rupture with that of the UIAs to identify the bacteria responsible for the rupture, but it is difficult given the low rupture rate. My big takeaway from this article is that the relationship between the gut microbiome and an aneurysm rupture may be unclear, but we definitely took a big step in finding the specific gut microbiome, Campylobacter, having a large relevance with rupturing cerebral aneurysms.